Hello, everyone, and welcome to this, our second town hall meeting for graduate students. My name's Richard Cutler, and I'm the interim Vice Provost of Graduate Studies. It's our goal to keep you informed and to listen to what you have to tell us. This town hall meeting and the COVID-19 survey that many of you have filled out already, and the emails that we sent out are all part of this effort. We want to tell you that we recognize your contributions as frontline personnel, teaching classes, recitation sections, labs, and carrying out important research. We want to tell you that we think that you're doing excellent work under the most stressful of conditions. And thank you very much for complying with USU's COVID-19 guidelines and setting a standard for other students. The focus of the content we'd like to share with you today is COVID-19 updates and mental health support. We're receiving reports of graduate students, including graduate teaching assistants and graduate instructors on the front lines, so to speak, teaching classes and labs who are struggling with stress, anxiety, and other mental health issues that are exacerbated by the COVID-19 pandemic. And this is affecting every aspect of their life, their work as a student, the whole gamut. So what we'd like to do is to support graduate students in terms of mental health, awareness, and wellness. I'd like to introduce the other participants in this town hall meeting. First, we have the Executive Vice President and Provost of Utah State University, Frank Gailey. Vice Provost and Director of Global Engagement, Janice Bettinger. Janice was acting Vice Provost of Graduate Studies over the summer and is still very active in the School of Graduate Studies. We're very fortunate to have Dr. Eri Bentley, the Director of Counseling and Psychological Services at Utah State University, and Dr. Scott Deberard, Executive Director of Student Health and Wellness and a professor in the Department of Psychology, joining us today. And finally, Nicole Vuvalis is Director of the Human Protections Office, which includes the Institutional Review Board. After our planned presentations, we'll have a question and answer section in which we'll respond to your questions, some of which we've already received from you. If you still have a question, you can ask them to me and the rest of the panelists using the question and answer feature. The questions won't be viewable by the other attendees unless the panelists choose to respond. And after you start typing your question, you will get to choose whether you want to submit it anonymously. We also recommend that you keep an eye on the chat box during this town hall, as we'll be posting links to some of the resources that we mention over the next hour. You will be able to view a recording of this entire town hall meeting as well as those links on the School of Graduate Studies YouTube page beginning sometime later tomorrow. So we've been conducting a survey of graduate student health and well-being and mental health throughout the COVID crisis. And I would now like to spend a little bit of time talking about some of the preliminary results. First, I'd like to say thank you so much to so many of you who have already responded. We've had 740 responses, which for a survey like this is absolutely outstanding, absolutely terrific. I want to say that these are preliminary results because the survey is still going through next Wednesday. And if some of the numbers don't quite add up, then please forgive us. We're sort of having to do some of the calculations and summary statistics on the fly. So how are you feeling overall about your current situation with regard to COVID-19? And yeah, we have the funny faces there, but something well over a third of respondents are not doing very well. So that's the 6.6 and the 29.7%. Have you or someone else that you know or interact with had COVID-19? So if you've scan to the right-hand side there, you will see the 13.1. So that means something like 87% of the respondents have had COVID, or a family member has, or a friend, or a colleague or classmate, or a fellow student, or some combination of these. So nearly everyone knows someone who has been afflicted by COVID-19. Have you or someone else had to isolate or quarantine? And in the left-hand bar there, you see you is at 39.1%. Blew my socks off, that number did. 39% of the respondents, graduate students at Utah State University, have had to isolate or quarantine. How has isolation or COVID-19 diagnosis of you or someone else affected you? So health challenges are up at the top of that list of things. Additional duties of work. We're hearing this over and over again with graduate students saying, look, I'm going to have to scale back on what I can do this semester or take a leave of absence because I've been asked to pick up additional duties at work. Additional caregiving duties. Again, we're hearing many cases of people having to look after children and perhaps parents as well. Additional duties in courses or research, particularly, I think, in teaching. The how much work that we're putting into research, all of those who are teaching, has gone up astronomically, and then various health challenges down at the bottom. So last question here, how concerned are you about your safety while on campus? And we've got the results here from fall, the most recent survey, and those are the white bars, and from summer 2020, and those are the blue bars. And I think actually there's, there's just a tiny smidge of hope in this. When I look at that very first bar, back in summer, something like 30% of the respondents to our survey there were extremely concerned about their safety while on campus. And now that number seems to be hovering around 11, 12%. And of course, that's a very significant improvement. And I think that's probably a testimony to the extensive work that has been carried out by Provost Gailey and many others here at Utah State University to manage the COVID crisis and to communicate that what we're doing to manage the COVID crisis. So I'd now like to, with that, to transition to Provost Gailey, who will provide us with information on how Utah State University is continuing to respond to COVID-19 and the many resources and things which are available to students and to faculty and staff. Provost?
Thank you, Vice Provost Cutler, and thank you all in our ranks of our graduate students. Really appreciate, as Richard indicated, appreciate the hard work that you're all putting in the laboratory, in the classroom, and obviously in your own programs as well. I think we're all aware that this COVID-19 pandemic has created special challenges for everybody, but it's not lost on me that the graduate students are in a position sometimes where they don't get the information that they need, or sometimes are unaware of the services that are available. So I'm hoping today that this will shed some light on that and continue this effort that Vice Provost Cutler, Vice Provost Bettinger, and Anna McIntyre and her team are trying to do to open up the lines of communication even further with all of you. The first thing I'd like to say is that and this is in partial answer to one of the questions we received a question saying it seems like a lot of things seem to be helter-skelter all over the place on campus in terms of addressing COVID. I want to assure you that we have quite a robust process in place for reviewing every application or proposal for either an event, a gathering, a classroom, or any other kind of activity on campus. Those protocols are actually required to be submitted, and they are archived, and there are certain elements that have to be there that follow the policies that we've set up, including masking, providing for social distancing, providing for quarantine and isolation in those unfortunate events where somebody is exposed. We have followed with those policies, the policies of the Centers for Disease Control very strictly. Many of you may be aware that Utah's case numbers out in the community are rising sharply. Here on campus, we're maintaining a pretty steady level. That is, obviously we don't want any, but the steady level is actually good news. And thanks to all of you, because I know all of you are working hard, not only yourselves and with your peers, but with the students in your classes and labs to make sure that the proper protocols are followed for disinfection, for wearing masks, for doing those things we know that limit the spread of this pandemic across campus. We're trying to provide some additional services for those of you who are on the front lines, those of you teaching laboratories, those of you who are TAs in classes that have face-to-face. And one of the things that we've offered to all the USU community is that we now have a testing program in place where you can sign in through Aggie Health, and I think Anna will get that up, and you can request a test even if you haven't been exposed or you're not sick. You can just sign up for a test, and our testing site is located on the east side of Maverick Stadium. You just go into the parking lot up on top there and follow the signs. We have basically commandeered one of the concession stands at the top of the stadium. And thanks to all of our nurses, all of our team from Wellness, Scott Deverard, thank you. And the Utah State Veterinary Diagnostic Lab, which has been approved to run the reverse transcriptase PCR. That's the gold standard test. And we can get that turned around for you in 24 hours for the most part. For those of you who are teaching, however, we have a special testing for all of you, or not testing, but a program where we will be over the next few weeks sending emails out reminding you that that testing is available on a voluntary basis. So if you're on the front lines and you're just concerned or you need it for peace of mind, sign up for a test, you can get that done. Again, that site is located on the east side of Maverick Stadium, but you must register and sign up for a test before you can get one. So again, follow the site and you can find that. The other thing we're doing is we're providing for wastewater testing. So we've identified sites across campus where we're testing wastewater. And our team has found out that that's very closely correlated with cases. Now, why is that important? It allows us to help provide some measure of protection by identifying hotspots in the undergraduate student population that we might need to go in and test a bunch of students or identify a cluster of cases. That's one way we've been able to kind of do surveillance, if you will, without being so intrusive. We're not making everybody on campus test. Rather, we're testing wastewater. We find a hotspot, then we go in and ask people to test. So again, a very well-defined protocol. So far, so good. What are we now? 8 weeks into the semester. We just have a few weeks left of face-to-face classes, and hopefully that will provide a measure of security as well. Two other things we're doing to try to support you as graduate students. One, for those of you who are the primary instructor in a face-to-face class, you will have available to you a dashboard in Canvas that will list those students in your course who are either in isolation or in quarantine. And so when they will rotate off of that status. In the past, people have just been getting a whole bunch of emails in their classes, and it's really hard to keep track of which students are remote, which students are supposed to be in class. Hopefully this will provide lots of help for you. And we've already gotten feedback from one faculty member in the College of Science. It's made her life a lot easier. And hopefully this will also make your lives as teaching assistants a little bit easier as well. The other thing that has not been rolled out and probably will be of limited use this semester, but for next spring, we will roll it out, is we're trying to identify some resources to provide for buffers, so that if one TA, for example, of a laboratory has to go out on quarantine, can we provide some backup in some way to help A, cover that course, but B, if one particular group of students from across several sections falls behind, can we provide some additional support to get those students caught up so you don't have to do that? So again, that's in the theoretical or startup phase, that program. But I want you to know we're constantly trying to listen for new, positive, progressive ideas and ways we can support you. Let me finish up by saying that that there are also plans for next spring. Next spring, courses will be offered in similar formats to this fall. We would obviously hope for a vaccine, but it's doubtful. And so for next spring, we're going to have a mixture of hybrid classes, face-to-face, broadcast, blend, all those different types of classes. So make sure as you work with your mentors and your supervisors that you know what kind of class is coming up for spring for you. The other thing that we're going to do is we've removed spring break. We're looking at ways to find other ways to provide a little bit of a break for our instructors. The reason we did that is best practice would suggest trying to avoid extensive travel and return to campus. Our goal is to try to keep campus with face-to-face offerings for you and for the rest of our students through the spring semester. So we're following kind of a similar general approach as we have for this fall. Just as a reminder, the 20th of November, we'll be going all remote, and we'll stay remote through finals in December. And then the last thing is we have identified indoor spaces for student course participation. So if you have students who are in Zoom or Zoom hybrid courses and they need a place inside to work on their classes, you can direct them to some open spaces that we've identified. There is a link that Anna will be putting out in your chat box that will lead you to a site where you can see where those locations are and the times that they're available, so you can direct your students to those places. So with that, I don't want to take too much of your time. I want to answer one question. I think I answered the first one in part. We do take a very systematic look at all of our programs, and we are focused on campus safety and protecting the perimeter. So I want to reassure you that. The other question that was kind of embedded in that has to do with the Institutional Review Board and what's being done to allow us to initiate human subjects research again. I can tell you Nicole is here. She'll go into details here. I am aware in at least one department that came up earlier, 2 proposals have been submitted. They've both been approved. And so some research is getting underway. But be aware that approval is contingent on federal regulations that would say that we have to have declining case numbers before any approved modified protocol could go in place. So you may be sitting on an approved protocol, but can't proceed because the case numbers are not declining in a steady fashion here. So watch this space closely. Nicole can get into more detail later on that one. The other question I guess I received is, why don't infected students need to test negative before being released from isolation? Very good reasons. Number one is that the science and the research is very clear that after 10 days of being tested positive, if your clinical signs are subsiding and you're not feverish for 24 hours, then you are not likely releasing any appreciable amount of viable virus at that point. The reason we don't test is because you may still have fragments of the DNA or the RNA in this case in your system, and you'll get a false positive potentially, yet be non-infectious. The research is very clear that if your symptoms are going down, you're not feverish for 24 hours, and you've been at it for 10 days, you are safe to return to work. And so I'll end with that. If there are further questions about that, feel free to reach out to Richard, myself. Frankly, I'd reach out to Scott Deverard. He's forgotten more of this stuff than I'll ever know. So with that, thank you, Richard. And thank you all, graduate students.
And thank you, Provost Gailey. And I think I speak for all of us who know how hard you've been working on this COVID issue, how well you and those who are working on your task force have kept us safe. This morning, I took the time to take a look at the infection rates and numbers for other institutions across the country. And I have to tell you that some of them are terrifying. Even here in Utah, I believe BYU has had nearly 3 times as many cases as we have had. And if you go down into neighboring states like Arizona and Colorado, the numbers are absolutely gigantic, and similarly in the southern states. So it's a measure of the effectiveness of the protocols that Utah State has instituted that our numbers are nowhere near as bad as those numbers.
Richard, if I could add one more thing. That doesn't mean to let our guard down, however. The evidence is very clear that while we're working very hard on campus, the numbers in Cache Valley and around Logan here are skyrocketing right now. Yeah. So it is in the community. So while we do everything we can on campus, we really have to rely on you to take care of yourselves out in the community. Be aware of your surroundings, wear your mask, and maintain that social distance, and have your families and roommates do the same.
Thank you. I'd now like to introduce Vice Provost Janice Bettinger, who is going to provide us with an introduction to the mental health aspect of this town hall meeting. Janice?
Thank you. Thank you, Vice Provost Cutler. We care about students. That's why we are requesting your input to our graduate student COVID survey for fall. I'd like to share some of those survey results. Regarding mental health. So we asked students, how would they rate the following? We had lots of positive responses to the format of classes, the quality of education, USU's response to COVID, but we have the greatest concern being overall mental health. So ranking last of all of those, overall mental health. We also asked what concerns you most, and the top concern is mental health challenges. More than 50% of respondents indicated mental health was a challenge. We also asked how useful would the following resources be to you? And again, the top cited resource would be mental health resources. So for this town hall, we invited Dr. Ari Bentley, the Director of Counseling and Psychological Services, also known as CAPS, to speak with us and talk about some mental well-being during the pandemic. We also invited Dr. Scott Deberard, Executive Director of Student Health and Wellness, to show us some mental health resources available to USU graduate students. Ari, I'll turn it over to you.
Thank you. Let me see if I can share my screen and then we'll go from there. Okay, I don't know if I'm sharing speaker view or, okay. Do you see my full slide? It doesn't really matter, I only have 3 slides. So I'm Ari Bentley, I'm at CAPS, and I'll be covering more of tips for coping with pandemic in the next few minutes. And then Scott, who is the Executive Director for CAPS and Student Health, he's gonna cover more on actual services available to you on campus. So as your survey was showing, mental health has been impacted significantly by the pandemic. And I just picked a couple of main tips that I thought all of us could benefit. We all know about Zoom fatigue at this point. It's nothing new. You're probably experiencing it at the moment. And since I don't have very wordy slides, if you want to close your eyes and take little screen breaks, this is the perfect time to be doing that. It's just that spending so much time on screen right now takes so much cognitive energy for all of us that even when you're talking with one person, your brain is processing so much information about their background, and you're even looking at yourself probably. So there's a lot of competing information coming in a way when we don't have access to information like nonverbal communication and gaze that we rely very heavily on during interpersonal communication. So a few tips, because Zoom seems unavoidable for us right now. A few tips we have is avoiding multitasking. You know, we're all guilty of this. If I were just attending this webinar right now, I'm probably checking my emails at the same time. It's so easy to be doing all of those things. And it might seem effective at that point, but you know, our brain is not made to be processing so many things at the same time. So it's highly recommended that you turn off those notifications, those emails, texting. They can wait until the meeting is done. You can just jot it on a post-it notes until the meeting is over and get back to it. Taking screen breaks is really important too. It's not just about blue light. It's about helping your brain reduce the amount of information that you're processing through your eyes too. So kind of creating culture in your meetings that it's okay to take your eyes off the screen, knowing that we're still paying attention to each other. I mean, holding eye contact, which is hard to do, impossible to do over Zoom, but pretending that can be exhausting. So looking away as needed, close your eyes right now could be helpful. And of course, not scheduling meetings back to back. Reducing on-screen distractions might be about turning off notifications for one, but also using maybe like speaker view instead of gallery view, so that you're not really having to take care of information from 8 different rooms and background, and you're only looking at one room at a time. And again, turning off self-view can be really helpful. And then before you schedule your Zoom meeting, think if it can be done any other ways. You know, could that be a phone meeting? Could that be an email? So if at the end of the day, if you're tired, you know, you might wanna check in with the person who you're meeting with and see if they'll be open to just meeting you over the phone. They might actually appreciate that too. And then the other set of tips is balance and self-compassion. None of us are immune from this impact of pandemic right now, and we're all impacted to a different degree at different times. So I can emphasize enough how important it is for us to be setting realistic goals right now. We just can't do the same thing, same way, same amount as pre-pandemic time right now. So really assessing what you're capable of doing, what resources, mental and everything you have right now, and then deciding, setting realistic, attainable goals. You might not be able to have a control over that completely. And ideally, everybody in your system will be part of it, including, you know, your advisor, your roommates, your family members. All of you can get together and decide what would be realistic and healthy for everybody's mental well-being. And self-care is important to schedule as well. When we get busy, we tend to skip that. But right now, functioning is like, you know, it's a difference between hiking in 90-degree weather versus 65-degree weather. And if you're hiking in the hot weather, you will be taking more breaks, drinking more water. So the same way with self-care, it might be taking more breaks, going outside, taking a quick nap, talking with your friend, whatever it might be for you. I want you to be able to schedule that once a day or multiple times a day. And other things are like, you know, sleep, eating, physical activities are important, and celebrating small things each day so that we can keep going and focusing on what we can control. Much of pandemic feels out of control, but for you to be focusing on your own, you know, sanitation practice, things, and how you're keeping yourself safe can be helpful. And of course, seeking social support. We always encourage that. You can learn any of these tips more in depth and all the other ways of coping with pandemic and stress management. I think it might be in the chat box now. CAPS can do that through workshop. We'll be happy to schedule one specifically for grad students if you like. We have self-care resources on our website, and then there are a couple of video and articles that if it hasn't been shared in the chat box yet, I can copy it there. So that's what I have, and then I'll turn the mic to Scott.
Okay. I'm Scott Deborah. I'm the Executive Director of Counseling and Health at Utah State University. I'm just going to be talking about some of the mental health resources that are available for USU graduate students. And just a brief outline of these services. First, I'll talk about CAPS services, mental health services in a little more detail. I'll also talk about the mental health services over at Student Health and Wellness. I also want to mention some services that are available through the United Healthcare Student Insurance Program that are new this year, that are free and actually quite impressive. And then briefly mention something about Aggie Thrive services if we have time. So first, CAPS. CAPS stands for Counseling and Psychological Services. This unit is the major unit on campus that provides the bulk of the mental health services for students here in Logan. This is the website for CAPS and also the phone number, and how you access services at CAPS is through our phone number, just calling the front desk assistants to schedule those appointments. Our hours are 8:30 to 5 Monday through Friday, and as of this past April, we transitioned fully to telehealth services. So all of our therapy, all of our outreach services are provided over Zoom. So it doesn't require that students have to come into the center to access services. This slide shows you kind of our complement of providers and the range of services that we're offering for this academic year. And we've got psychologists and interns and practicum students, social workers, and so forth. We also have 10 Reach peers this year that are working with their fellow students in terms of outreach activities as well. We offer outreach activities, workshops, individual and group and couples counseling. We also have single sessions. It's something that's new from last year, where we have a session where a person can come in and talk to a counselor if they're struggling with an acute stressor and just want to see a counselor for one session. And those can be scheduled quickly typically without a long waiting period. Cost and eligibility for CAPS. Counseling services through CAPS are provided free of charge. And this is provided the graduate students are enrolled in 6 credits. Traditionally, we've limited individual therapy and group therapy to graduate students that are enrolled in at least 6 credits. We've received some input from graduate students that there's quite a few students that are working full-time within their graduate programs that we're told that they don't qualify for CAPS services. We're looking at that policy now and are going to revisit that. If you're in that boat where you're working in a graduate program and enrolled for less than 6 credits, let us know, let our front office staff know, and we likely will be offering some exceptions to that as we develop our new policy. We do charge some extra fees for psychoeducational testing if that's something that you need at CAPS. In terms of student health and wellness, this is our full service primary care clinic that is located north of Maverick Stadium. We've got several licensed providers there, primary care providers, as well as we offer mental health services through Student Health and Wellness too. You can access Student Health and Wellness through calling the phone number 797-1660. You can also do online scheduling through www.health.usu.edu. You can schedule both medical appointments and also mental health appointments through that online scheduling system. We're open 8 to 5 Monday through Friday during the regular academic year. We also transitioned fully to telehealth this past April. We still offer some in-person visits for medical needs if they're warranted and if students test negative for COVID using one of our rapid tests. In terms of our mental health therapy that we offer over at Student Health and Wellness, we offer brief mental health therapy sessions over there, typically 30 minutes. These are offered on a weekly basis. They're provided by 5 separate graduate students, PhD students that are supervised by a licensed psychologist. Things we see over there: depression, anxiety, adjustment to college, stress, so forth. And these services, again, like CAPS, are provided free of charge. And for over at Student Health and Wellness, as long as you're enrolled and paying some student fees, we allow you to access services, all the services at the Student Health and Wellness, including mental health services. I wanted to mention this to you. This is our USU Student Health Insurance Plan. This is a plan that for many graduate students will look familiar. Many of you have signed up for this program, and many of you have received a subsidy from your department to sign up for this program. This is offered through United Healthcare. And I've listed we'll provide this to you later, I've listed the website where you can read about the policy and what it covers. And I've provided some of the information here on this slide. I'm not going to go into the deductibles or those issues, but I want you to have that, and we'll get the web link to you for that as well. The exciting thing about United Healthcare is that it offers this student assistance program, which is new for this year, for this version of the policy. And what this program offers is free counseling. It also offers web-based wellness services that students can access, legal and financial services, and mediation services, interestingly. This is a great program, great addition to the student health insurance program. This is the Healthiest You app that is the interface for accessing mental health services through United Healthcare. So this is what you would download to access mental health services as a graduate student. The charge for this is zero for if you're enrolled, both for visiting a licensed therapist or for having a session with a psychiatrist. So this is great to know about. I think the maximum number of sessions is 6 sessions without any cost. This is a great option for many students, I believe. The other thing I wanted to point out too, in terms of another resource for students during COVID, is this Aggies Thrive program. This is a kind of a mental health support system that has been developed by USU Human Resources. And I'm providing the kind of a screenshot of the website here. There's also the hashtag there. This provides a whole array of support services and trainings and things that can benefit not only regular USU employees, but also student employees here at USU, which many of you are. I urge you to take a look at these services. We don't have time to go through all of them. If you have questions about these, I can also answer them during the Q&A too. But what I want to end with is just by letting graduate students know that we have transitioned in terms of our mental health coverage to telehealth here. We have capacity to be able to handle students. So if you've got concerns or issues regarding mental health and want to get some help, feel free to access these services. And if you're struggling getting access to services, let somebody know. I provide my contact information on the very first slide of this presentation too, which we'll get to you. And if you have any concerns about that, feel free to contact me and reach out, and we'll try and connect you with the appropriate service. That's all I had. Thank you.
Thank you so much, Dr. Bentley and Dr. Deberard. I, in fact, switched from gallery view to speaker view, and my stress level went down. And I'm breathing. Okay, I'll turn it over to Interim Vice Provost Cutler to introduce our next speaker.
Yeah, thank you very much, Dr. Bentley, Dr. Deberard. I particularly liked the clarification you gave on, if you're not registered for 6 credits, then still come along. I mean, this is an issue that several graduate students had raised with us individually, even before the town hall meeting. So I'd now like to introduce Nicole Vivalis, who is the director of the Human Protections Office, which includes the Institutional Review Board, or IRB. In spring semester, much of the research on human subjects had to be abruptly stopped, and now there's a process of restarting and authorizing new research, and Nicole is going to fill us in on that.
Thank you so much, Dr. Cutler. As mentioned, my name's Nicole Vuvalis. I'm the Director of Human Research Protections here at USU. In that role, I facilitate the efforts of the Institutional Review Board, the IRB, and that is the committee that approves or disapproves human subjects research. And as mentioned, as most other institutions did, in March of this year, we did pause in-person human subjects research. We're happy to say that the vast majority of human subjects research at USU was unaffected. So initially, there were about 19% of projects that experienced that pause. It turns out that many of those projects had already collected their data. Several others decided to close the project because they didn't want to put themselves at risk. And so we're currently sitting at about 100 projects, or about 14% of our total workload that are in a pause state. Now, if you're one of those 14, it's a big deal. And we recognize that that's a large impact on your academic career here at USU. For the last 2 months, the IRB has been reviewing requests to resume in-person research. Its focus is currently on those activities that present low risk for the transmission of the virus. And as Provost Gailey mentioned, even with those approvals, in-person procedures will not actually begin again until there are 14 days of a downward trend in positivity rates, or until Utah reaches and settles at a 5% or lesser positivity rate in testing. And that comes from, as mentioned, the recommendations from the CDC and WHO about when an appropriate reopening should take place. So I emphasized that we were looking primarily at low risk projects. And what does that look like? Here at USU, we've adopted a sort of visual framework for resuming in-person projects. I'm going to pop that information into the chat for you all so that you can follow along if you like. But I will also share my screen so that you can just watch. So this is the framework that we've adopted, and we've tried to place the sort of levels of risk and transmission criteria on a visual scale of sort of that green area, or the least amount of risk, to that red area, or the most amount of risk. And so you'll see that we're looking at things like the proximity of the individuals and how many individuals will be in that space. What are the characteristics of that space? Does it have good ventilation? Has it been approved to, for example, have a class taught in it? Or there are several buildings on campus that have been deemed unsuitable for the transmission of the virus and safety measures. Are you looking to carry out research there? What about outdoors versus indoors? And then, of course, things having to do with the participants themselves. So for now, research with elderly participants is unlikely to move forward simply because those individuals are at the highest risk of death or very serious outcomes if they were to contract COVID-19. And so we're looking at all of those factors, and it's helpful to sort of see where these things all lie on a scale, but it's also important to note that there's no make or break criteria here. So having an area, one area in the red is not going to be the case that you can't resume your project in person. And so I encourage you to use this as a guide. However, what I'd really encourage you to do is to have a meeting with our staff if you are interested in resuming your project in person. I'll share another link with you. We tried to make this whole meeting thing pretty easy. So if you've got, so we've got it set up so that you can just take your calendar, figure out where it works in your setting and in your space, and then just book a consultation with somebody from our office. We're using Calendly to do that. And so under this link that I've just sent, the one that ends in new-faculty, there's a consultations tab. If you click there, you can book a consultation without sending any scheduling emails or anything like that with one of our coordinators. And we'd love to talk with you about how your project might be able to resume. And then finally, we do have instructions on our website for how to request resumption of your project. The application itself is in Kuali, and there's a template of that application on the irb.usu.edu/COVID-19 website. So you don't have to log in and then have to start the application. You can go there, check out that template, see what kinds of things we're asking, and then you can go and file an application if you're feeling like you'd like to resume your in-person procedures. Something Provost Gailey touched on earlier, It seems like some folks are concerned that there's a discrepancy in how things are being treated across the institution. As he noted, there are really robust policies and procedures and review processes in place for things like events and courses and items like that. Similarly, we have robust processes in place for what it is that we do. And the IRB is really only allowed to focus on risks to participants. We're not permitted to take into account those competing interests of, for example, a grant that's waiting on you to move forward, or, things like that. Unfortunately, that is not the IRB's role. We are only allowed to think about the risks to the participants and how to minimize those risks, and in some cases, maximize benefits. And so that might be part of why some people are viewing that as a discrepant experience, but really it is serving entirely within the mission of the IRB itself. All that to say, though, we're still very interested in helping you to move your projects forward. Because we get the great fortune of seeing all of the human subjects research on this campus, we might be aware of processes or resources or populations that are in place that could help you to move your project forward that you might not have been exposed to yet. So we'd love to chat with you about your project. Please go ahead and book that consultation if you like, and anything we can do to help you move through this trying time, we're very happy to do. Thank you.
Thank you very much, Nicole. Appreciate the work that you do, and I think you made it very clear, the role of the IRB and the steps to move forward with research, and I think we're all very grateful to hear about that. Thank you. So related to this, we became aware very early on that some students' research was very significantly impacted due to COVID-19. Many of those were students whose work involved human subjects, but there are others too. Field seasons have been cancelled in some cases. And so we solicited information from the departments and colleges through the deans about how many students might be affected in this way, and tried to identify some resources within the School of Graduate Studies to provide additional tuition remission, so that if people had to extend their research programs for longer than they originally anticipated, that we would still be able to provide them with the tuition remission during that time. And I'm happy to say we were able to identify some resources, and we're now we're going to work with the deans again to go back and say, okay, identify the people, and we'll transfer the tuition waivers over to your respective colleges, so that you can facilitate the ongoing research of the students. So we're working hard to try and help students when they run into these kinds of real calamities with regards to their research. So thank you once again, Nicole. Appreciate your presence here in the this town hall meeting, and for the excellent information that you have provided. So I'd now like to move into the question and answer part of this town hall event. Thank you to those of you who have submitted questions in advance of the town hall meeting. We'll be answering those below. And a quick note to say that you can still ask questions using the question and answer feature. We'll try and answer as many of those as we can, as time permits, at the end. And so I'm going to get the ball rolling by asking a question of Vice Provost Bettinger, which is there any possibility of opening family housing for single graduate students? Graduate students have very different requirements for housing than undergraduates, especially now that most research is done from home. It is not possible in a traditional dorm with roommates. We have apartment-style housing, but only for married students. I think it should be open to all graduate students as well.
Thanks, Richard. Apartment-style housing is available for single students, including graduate students at USU. There is a page at housing for single students, and if you get on that web page and you scroll down to the bottom, to apartment style, you can view the options. According to USU Housing, most graduate students choose to live in Darwin or Blue Square apartments because they have an age limit of students must be, above 19 years of age. But all apartment style housing is available to all students, all single students at USU.
Mhm. Thank you, Janice.
Okay, I have a question for you, Richard, that we received before this town hall. Many graduate schools across the nation no longer require GRE scores for admissions to master's or PhD programs. They seem to understand that standardized test scores in isolated areas may not be an effective indicator of whether or not a student is graduate school material. Particularly at the PhD level, the GRE seems redundant. Why is this still a requirement at USU, and is there anything currently in the works regarding changing this? I understand that with current COVID conditions, each department is allowed to decide whether or not to lift the GRE requirement. The trouble is this causes discrepancies and divisions, not only between departments, but between students. Quite frankly, it's simply not a fair system. I believe the School of Graduate Studies should make this call and have it consistent across the university. I also encourage graduate studies to consider dropping this requirement. It's a tradition with no real efficacy. And the person who submitted that, thanks for our consideration and for allowing that person to have a voice.
Thank you very much, Janice. I am actually very happy to answer this question. It has been at the very top of my to-do list from the time I took the position as interim vice provost. So the value of the GRE for graduate admissions has been under discussion by Graduate Council, among the academic deans and in other venues. In the meeting on October the 14th, Graduate Council voted unanimously to remove the GRE as an overall or global requirement for graduate study at Utah State University, and to allow individual departments to make decisions about whether the GRE is required for some or all of its graduate programs. The issue now goes to Academic Standards Committee and then the Educational Policies Committee for consideration. But I think that the word that I am hearing is this is not a controversial issue at all. I had School of Graduate Studies staff look at the graduate school websites in regional research intensive universities and found that pretty much all of them have the policy that Graduate Council passed in its last meeting. That is that the GRE is not required by the institution, but individual departments may require it for some programs. And I think that's probably where the decision really ought to be made, because there are some departments, some colleges, and certainly some programs sprinkled through other departments and colleges where the GRE has been found to be helpful in making decisions. But as a global requirement for programs where it may not be applicable at all, and indeed may discourage applicants in underrepresented groups, I think it's a good thing that we remove this as an overall requirement. So the take-home message is, yes, the GRE is being removed as an overall requirement. Okay, another question for Janice. With so much on hold and shut down on campus, I worry that I won't have many opportunities to lead, provide service, mentorship, socialize and be involved in on-campus activities this year. What suggestions do you have for helping students feel connected, socialize with others, and be involved in activities on and off campus that would look good on a resume for future employers?
Hey, I say this is your opportunity to help figure this out. Yes, this is a really challenging time, but if you can be creative and brainstorm and maybe think about how to socialize, how to be an activist, how to engage your colleagues, do it and put it on your resume that you did that. Recently in the School of Graduate Studies, we brainstormed ideas for holding small in-person or virtual social events that are safe. We emailed this to graduate faculty And we just put the link to that email in the chat box. So check that out for some ideas to help you get started in engaging with other people on campus and off campus. Okay, well, I have a question for you, Richard.
Back and forth.
What should we do if we do not feel heard by our program, like our concerns at understanding policy or the material as being dismissed as laziness or stupidity?
Yeah, I'm not quite sure what you mean by program. Is it instructors or faculty mentor or someone else? Some people that you certainly should be talking to are your faculty mentor, graduate program coordinator, and perhaps your department head. If there are still issues that are not being resolved, I'd be happy to speak with you over in the School of Graduate Studies. If there are any issues that cannot be resolved, at the department and college level, and that's very, very rare, then, please do reach out, and we will try and help as much as we can in the School of Graduate Studies. Okay, Janice, back to you now. Will the university be able to have some sort of commencement in May? To clarify, I'm by no means expecting a large ceremony like what normally happen, but is it possible to do or to plan for small departmental ceremonies with just primary advisors, department heads, and those graduating? No family, but it could be broadcast to include those. I only ask because after June, I have no idea where in the country I will end up, and the chances are I won't have a time in a tenure track position or a postdoc to come back and walk close to finals.
Okay. Currently, the university is planning a traditional commencement as shown on the commencement website. The commencement steering committee is also considering possible alternative options depending upon the public health circumstances at the time. We anticipate that we'll know in early March whether the health situation will permit a traditional commencement week with all the festivities or whether we will be offering alternatives. The steering committee welcomes input for those of you who are graduating, and questions and comments can be sent email to commencement@usu.edu. Okay, another question for you, Richard. What happens if I get COVID-19 and fall behind in my work? Will I be able to withdraw from classes and apply the tuition I've already paid to next semester?
Okay, so if you get COVID-19, then absolute first step is to complete the COVID questionnaire. That's absolutely critical. And then the second step is to develop a plan with your instructors to complete the course. You may need to take an incomplete grade, which allows you up to a year to complete the coursework. And the date for withdrawal from classes has already passed, so you wouldn't receive a tuition refund. But if you get an incomplete, you have that year to make up the grade for the course. You don't need to re-register for the class, and you don't need to pay tuition for the class again.
Okay, another question for you, Richard. Is it true that graduate students need to get B's and above to pass?
That's not a School of Graduate Studies requirement. The School of Graduate Studies requirements are for a C or higher in all courses and an overall GPA of at least 3.0. However, some departments have higher grade requirements, B- or B, so you need to check with your department as to the grade requirement for your program.
Okay, the questioner goes on. Some of the classes I signed up for have more work involved because they are offered online as opposed to if they were offered on campus. So now I have more lecture material and videos to go over, and also additional Zoom meetings and other hardships trying to get help in a group setting. I also have kids at home, and we started a new homeschool program due to COVID. Because of all of these changes, I am not doing as well as I would like in my program, and I am losing sleep and I'm constantly sick. If I were to continue not to do so well this semester, can I retake these courses next fall? and extend my graduation for another semester or year. What will happen as far as my status in the program?
Yeah, so
Yeah, go ahead.
yeah, I was just going to say this is a long, complex problem, a question, and I think I'm sorry I cut you off before you finished. The last bit of this is I think there's a mental health situation, because if I knew that I could recover later on this semester, then maybe I could be at ease somewhat. And so this is a long, complex question, and I think that this is really where a number of people are coming from. We've heard variations of this in many different venues and forums. So if you're struggling with your courses, then you need to get in touch with your instructors right away. And it may be that an incomplete would be appropriate in one or more classes. But in any case, I think talking to the instructor is always the very first stop in trying to determine a path through a semester. Now, we understand that many students are struggling right now, and we recommend that you talk to your advisor and to other departmental representatives. Everybody understands just how difficult the situation is, and recognizes that it is particularly bad for graduate students with so many competing interests for time and for attention. And so we all want to help you get through your program and make accommodations that will help you reduce your stress. Now, there is an issue here of mental health, and I think that rather than me take a shot at this, I'd like to ask Dr. Bentley if she could perhaps give us a little bit of advice here.
I would just, as far as advice goes, I think you're right. It's pretty complex, and there is a lot of case by case, scenarios and differences. But CAPS, we are really here to provide support, even when there is not much, you might be able to do to change the situation, improve the situation. We can at least create a space to give you a little break to process what you're experiencing, provide a support, and work on building resilience and coping strategies that you could access. Another thing is, if you get to a point that you decide to seek accommodations officially, we do provide documentations for ongoing clients. So that would be another reason for connecting with us sooner than later as well. Because if somebody just comes to our door and asks for a letter and we don't have any history, we won't be able to, we won't have information to do that for them.
Thank you very much, Dr. Bentley. We got a follow-up question in the Q&A. Won't an incomplete look bad on your transcript if you're going to try and get a postdoctoral position or a faculty position? And I think the answer to that is a very clear no. Most institutions understand the role that incompletes take. And here at Utah State University, all research until very recently was labeled as incomplete and then made up at the very end. And so when the course is made up, then the incomplete becomes irrelevant. So no, I don't think an incomplete looks bad on your transcript. Dr. Bentley, I have another one for you that was presented to us in advance of this town hall meeting. How can we take care of ourselves while still supporting people around us, like friends, family, roommates, who are receiving help but are still struggling with mental health?
That's a really great question, because all of us are struggling one way or the other right now. I would really emphasize first taking care of ourselves first too. It's cliche, but we hear when we get on airplane, which we might not be doing as much anymore, but we hear about putting on an oxygen mask on ourselves first before helping others. So that becomes important. Realistically too, I think taking turns to help each other out could be really helpful. So wider net you can cast of your support system. You know, somebody can be doing better at any given point. So really taking turns to do maybe a little extra for your friends or family members, and being willing to be the one to ask for help when you need one as well. And then it goes back to working with everybody in your system to set realistic expectations and standards. The last thing I would say is when I speak about self-care and scheduling it, you can almost like accomplish multiple things by scheduling self-care activities together, doing something together that can make it easier sometimes as accountability buddy. It can create social connection piece, whether it's virtually or outdoor in a safe distance ways. But there are a number of ways I think we can still make it happen.
Great, thank you, Dr. Bentley.
Okay. To find where we are now. Okay, this question for you, Richard. I feel like I am the only one in my department that needs to take their path through graduate school a lot slower due to my family and home obligations. I have always heard of people graduating in the expected 2 to 4 years and on track, and I want to make sure I am not alone in the fact that it might take me 3 or more years to complete my master's degree. Is this becoming more normal?
Thank you, Janice. So in answer to the person who posed the question, you are absolutely not alone in finding your path through graduate school is slower than you originally anticipated. From the COVID-19 surveys of graduate students and from other sources, including anecdotal information from colleagues and department heads, we know that many students are under incredible stress. And from their studies and trying to balance their studies and research and family situations. And this is really a challenging time for everyone. I think it's too soon to say that the slower completion is the new norm. I suspect that that's going to vary from department to department and perhaps even among programs within a single department. As I talked about earlier, we know of students whose research has been affected by the COVID-19 pandemic to the extent that will delay their degree completion. And we've been able to identify tuition waivers that will help support them in future semesters. And I think what I'd like to add here is we would hope to be able to do this, to identify students who've genuinely been very impacted by COVID-19 and to be able to provide some assistance in their perhaps longer programs of study here at Utah State University. But be assured, you are not alone. Unfortunately, there are many who are going through very similar things right now.
Okay. Another question. This is my first semester, both in the state of Utah and at USU as a graduate student. With everything going on in the world, I feel like my own ability to get a solid education has really tanked. I want to continue my graduate studies, but I don't know if I'll retain what I've learned or pass my classes. What advice do you have for students who are struggling in their programs right now? Would deferring enrollment at USU for a few months be a possibility or a smart move?
Okay, so this is again a complex question, and we've heard many variations of the same thing. So I'd like to sort of segment it into some different pieces. Despite the pandemic, we're convinced that we are able to offer a very high quality education, graduate education here at Utah State University. I continue to teach graduate classes and serve on several graduate student committees. USU faculty have been amazingly active and creative in building online and hybrid alternatives to face-to-face classes, and building lab experiences that meet social distancing and other safety standards for COVID. In the slides summarizing some of the questions from the COVID survey that is still active, we saw that students seem to be happier with the courses. They're comfortable with the courses and the formats that the courses are in. I don't believe that much is going to change in the next few months. You heard that Provost Gailey talk about decisions that have already been made about spring semester. Basically, we don't expect the situation to change or improve in the near future. So my advice, if you're struggling with your in your program, is to reach out to instructors of your courses that you're struggling in, to your faculty mentors, to your graduate program coordinators, and to avail yourself of many of the resources that Dr. Bentley and Dr. Deberard have mentioned earlier in this town hall meeting. It is true that more students have taken leaves of absence this semester than in previous semesters, but many are continuing in their graduate programs. Most are continuing in their graduate programs. So I don't have a firm recommendation about taking a leave of absence from graduate studies. I think that's a very individual decision that you will have to make.
Okay, thank you. Shifting gears now, how is USU planning to involve graduate students in the decisions regarding the possible changes in USU's health insurance for graduate students and their dependents?
Yeah, so this is one of the most important topics. I know COVID is dominating everything, but covering graduate students with health insurance is an incredibly important topic too. The answer to the question is through the Graduate Studies Senator, Alex Brager. He sits on the committee that has been writing the request for proposals, and that will ultimately make a recommendation to Provost Gailey and to President Cockett. And if you have any questions or concerns or would like to provide input to the committee, please contact Alex. I know he has spoken with some people because I've received some really good questions from him. And so I would recommend that you talk to Alex. I noticed that there was a new question that was coming in related to this, if you'll forgive me for continuing on. And that was a question about whether there is currently dental coverage with the insurance. At the moment, there is not. What we are doing with the request for proposals is that we have inserted an option for the people who respond to the request for proposals to give prices with and without dental coverage. And we're very hopeful that we will be able to add dental coverage in the next round of health insurance.
Okay. Moving on to tuition waivers, we had a follow-up question about the tuition waivers. Is there a finite number of tuition waivers, and those whose research has been impacted are being allocated more of those waivers, or are these additional waivers?
Can I say it's complicated? Okay, so there are some unlimited categories of waivers for students who are on 50% assistantships, whether they be research or teaching assistantships. And then there is a pool of funding which comes to us from the state. Traditionally, the School of Graduate Studies has retained some of those additional waivers, and at the end of each semester distributed those waivers to colleges which have a need for additional waivers, and through programs such as a dissertation fellowship, which combines a small stipend with tuition waiver. So we've got multiple sources here, and we've also got a reduced number of students. Some members of the PDRF fellowship program, particularly international students, have not been able to come to the United States and start their program. As I indicated earlier, more students have been able to have elected to take leaves of absence. And so we actually have a few more tuition waivers available than we would in a traditional semester. And so The answer is really a hybrid. I'm sorry to give you such a long-winded answer, but the answer is really a hybrid of yes, there are some waivers which are unlimited, and yes, there are some waivers that were previously used to another purpose. There aren't any new waivers, but there still look to be enough waivers to cover many of the situations that we are aware of at this time.
Great, thank you. We had a question on the proposed rule change eliminating duration of status by the Department of Homeland Security. This is causing a lot of anxiety among international students. I don't expect the university to provide a solution, but what advice does this panel have that can alleviate some of the worries and anxieties? I can start with this. The other day, we sent out an email from the Office of Global Engagement to all international students and scholars with some key points. And so if you would like to have the link to that email, I can put that in the chat box once I find it. I wasn't prepared to drop that link in there. The other thing is I'll also put in the link, comments are welcome. The comment period closes at 11:59 p.m. Eastern time on Monday, October 26th. If you have a story of a success by yourself, by your graduate student, by your colleagues, by alumni, and how this change in duration of status, moving it to the duration of your whole program, to then limiting it to either a 2 or 4 year period. Please write that comment and submit it to Homeland Security. The Department of Homeland Security is required to read and consider all of those comments. And if they get a flood of comments articulating clearly with data and or real stories of how this is going to be so detrimental to universities in general, to the lives of international students, that will impact the research and teaching missions at Utah State University, please go ahead and submit those comments. Okay, question for you, Richard.
Okay.
Since everything takes more time, more work, more energy, more compromises, more familial responsibilities, more everything during a worldwide pandemic, wouldn't it make sense to consider smaller amounts of credits, research, etc., as full-time? Would there be any way to decrease the amount that the School of Graduate Studies expects from students as standard during such a challenging time?
That's a good question. It's one that I haven't heard before. And I think this is something that we might consider. There are some important issues here with regard to financial aid and with regard to accreditation of the institution. And so these would have to be elements that would be included in such a discussion. But I do understand this issue of perhaps it's not possible to work with 6 or 9 credits or to take a full 6 or 9 credits, maybe 3 credits a semester. And so we should initiate a discussion along that. Now, the requirements for the individual programs, they're actually determined by the departments for the most part. And I think that probably most would say, you know, it's an issue of, you know, to what extent you can change the programs without compromising the quality and what we expect a student to know and to be able to do at the end of completing a program. So I would suggest that this is a thornier issue and one that is not properly at the level of the School of Graduate Studies. Okay, I've got, I'm sorry?
Oh, okay. Sorry, I didn't mean to interrupt.
No, that's fine. I wondered if you were asking me to clarify something or restate something. It's been incredibly difficult to connect with my cohort in any kind of a substantial way or to develop a support system since I moved to Logan in the midst of a pandemic. I'm utilizing psychological services at USU and calling faraway friends when time permits. but I wondered if you had any advice on how to connect safely with peers, as many of us wade through this difficult first semester. Janice, can you throw some insights on?
Okay, we had a great comment in the chat box to panelists with regard to this type of question. It's a great time to get involved in leadership positions at professional societies. There are more opportunities now than ever to get engaged. So whatever your academic field, seek out the professional society and see if there are opportunities to get involved, serve on committees, or do other kinds of leadership positions. We also had some questions related to this. Utah's dominant culture is tied to religion. If you're new to Utah and USU and you're not a member of this religious community, what's the best way to build your own community, especially during a pandemic? Make your own community. And I think we sent out the chat box, or in the chat box, the email that we had suggestions for doing small person or virtual socials, but also connecting with your professional society, connecting with a community that maybe is not normally in the office next door, but now they're working at home. Connect with this larger community that can also advance your academic and professional goals. If you're interested in getting involved more with the community, Utah State University or your community that you live in, there are some great examples. At Utah State University, there is the Val R. Christensen Service Center, and we can put the link to that there. You can volunteer for places such as the Student Nutrition Access Center or a number of different projects related to the university. In the community, depending on where you live, there is probably a clearinghouse such as the United Way in your particular area. Cache Valley, Utah has a website for the United Way of Cache Valley with links to many volunteer opportunities. There are also a few, if you enjoy the environment and you live in Cache Valley, there's Stokes Nature Center, always looking for volunteers to involve the community, children. The Cache Refugee and Immigrant Connections are always looking for volunteers to help immigrants and refugees learn how to apply for Social Security or for housing assistance or for unemployment or to learn English. Citizens Against Physical and Sexual Abuse, or CAPSA, is always looking for volunteers as well to staff their phone lines, to be a companion for people who are struggling. So I encourage you to be creative, go out, make some opportunities if they're not there, and take advantage of those opportunities that are there.